Today we're going to go through the pharmacology of chlorpromazine step by step. Chlorpromazine belongs to the class of first-generation antipsychotics, which means it is primarily used to treat schizophrenia and bipolar disorder. Its primary mechanism is blocking D2 dopamine receptors in certain parts of the brain, and by doing this, it reduces the positive symptoms of schizophrenia, which mainly include hallucinations and delusions. These positive symptoms are caused by excessive dopaminergic activity, so blocking dopamine helps control them. Chlorpromazine also has several secondary mechanisms. It blocks serotonin receptors, specifically 5-HT2 receptors, which can contribute to its antipsychotic and mood-stabilizing effects. It also blocks H1 histamine receptors, and since H1 receptors are responsible for wakefulness, this blockade gives chlorpromazine strong sedative properties and also contributes to antiemetic effects. Additionally, chlorpromazine has anticholinergic properties, specifically antimuscarinic effects at M1 and M2 receptors, which can lead to dry mouth, constipation, and blurred vision. Primarily, chlorpromazine is used for its antipsychotic effects, treating hallucinations and delusions, and it can be given orally or rectally. It also has antiemetic effects, meaning it can control nausea and vomiting. This works because chlorpromazine blocks D2 receptors in the chemoreceptor trigger zone, preventing dopamine from activating these receptors, which stops proemetic signals from reaching the vomiting center in the brain and prevents the vomiting reflex. It is often used orally in palliative care to manage nausea. Another interesting use is for intractable hiccups. Intractable hiccups are persistent hiccups that last more than 48 hours or are severe enough to interfere with daily life, and chlorpromazine works here as a dopamine antagonist, interrupting the central hiccup reflex arc. Chlorpromazine should not be used in certain conditions. It is contraindicated in CNS depression or comatose states because it is a potent CNS depressant through D2 antagonism and antihistamine effects. So giving it to someone already comatose or heavily sedated can cause respiratory depression or hypotension. It is also contraindicated in hypothyroidism because people with hypothyroidism have slowed metabolism, bradycardia, hypotension, and reduced drug clearance. So chlorpromazine can lead to profound sedation and dangerous hypotension in these patients. Side effects are common and can be explained by its pharmacology. Anxiety may occur because D2 blockade in multiple CNS pathways can lead to emotional blunting or dysregulation. Glucose tolerance can be impaired because chlorpromazine affects glucose metabolism, leading to hypoglycemia, and H1 and 5-HT2 receptor blockade can also cause weight gain and increased appetite. Muscle tone can increase because chlorpromazine blocks dopamine in the nigrostriatal pathway, which normally helps control smooth, relaxed movements. And this blockade causes muscles to become stiff and rigid, leading to slower, more rigid movements.